Hello, and welcome to Franklin Forward FAQ, a weekly video series answering questions from Franklin County residents about COVID-19 and how your family can safely navigate these unprecedented times. I'm Dr. Linda Thomas-Worthy, your host. Each week, we will hear from local leaders providing answers to your questions based on guidelines and recommendations from reliable expert sources. Joining me today are Dr. Michael Colli, Chief Medical Director and Director of Pediatrics at Keystone Health, and John Thierwechter, Assistant County Administrator of Franklin County Government. Hello to you both.
Good afternoon.
Hi, Dr. Thomas-Worthy.
Our first question for today is about mask wearing. Now, we know this topic has been politicized, resulting in a lot of confusion and misinformation out there about whether or not people should wear masks. Dr. Colli, could you please clarify for us, what is the purpose of a mask and why should I have to wear one?
Well, thank you for the question. It's a very pertinent question today. So let's first go over what the different types of masks are. So you have a cloth mask, you have a surgical mask, and you have an N95. And the N95 is part of the full personal protective equipment, or PPE, that is worn by people in the medical field. So the really relevant ones that we should be talking about are the cloth and the surgical mask. And I just want to take a second to review how to wear a mask. In reality, the mask should cover the nose and the mouth, the two highest particle generating portions of our body. So it really should fit over both the nose and mouth. It shouldn't be just over the mouth. It shouldn't be around the chin. It should really cover the entire nose and mouth region. So the really relevant ones for the community are going to be the cloth and surgical mask because that's what people are going to have access to. We really want to leave the N95s to those in the healthcare field who are taking care of the sick COVID-19 patients. And one of the important concepts that I think people need to know is that the idea is that if I wear a mask, it's protecting you from me, not vice versa. So if I'm wearing a mask, I'm keeping you safe by wearing that mask. And we know that if you're infected with COVID-19, even something as simple as talking can transmit virus particles. You don't have to be sneezing or coughing. Just talking alone can generate viral particles. Studies have shown that wearing a surgical or cloth mask can reduce the transmission of those viral particles by up to 90%. So they can be very effective at limiting the spread of the virus. The analogy I like to give and why it's important for the person who may be infected with COVID to wear the mask is analogous to a fire hydrant. So you can imagine if someone turns a fire hydrant on and it's gushing a bunch of water, and you walk by that fire hydrant and you don't want to get wet. What can you do to protect yourself? Well, you can have an umbrella or you can wear a raincoat. But how effective is that going to be if that fire hydrant is really gushing water at you? You're probably still going to get wet. So a better way to protect yourself is actually to turn the fire hydrant off at the source. If you do that, and that's analogous to the person who's sick wearing the mask, if you do that, you do a much better job of protecting people in the community. Turning off the fire hydrant at the source is better than using an umbrella. In addition to that, we know that many people with COVID-19 are contagious before they become symptomatic. We call that pre-symptomatic spread. They can also be contagious without ever developing symptoms at all. We call that asymptomatic spread. So if you only wore a mask when you were showing symptoms, there may be a portion of the population that's contagious without symptoms at all. And we know that this is becoming more and more prevalent and more of a common entity. There were several what they call super spreader events where one person infected dozens, if not hundreds of people. And that super spreader may not have had any symptoms at all, may not have even realized that they were sick. So the concept of universal masking for everybody to wear a mask is really to protect everybody else, and especially for people who may not even realize that they're sick because they don't have symptoms yet. This all comes down to how do we reduce this, how do we get rid of this pandemic? How do we reduce the spread of this condition? And I don't want to get too technical, but there's a concept called the reproductive number of the virus. And you really want that reproductive number to go down. The lower the reproductive number, the less people that someone with the disease infects, then the faster we will mitigate the spread of this disease. So if everybody masks, we know that we can reduce that reproductive number, or what they call the R0, to a level that makes the pandemic go away much faster. So it's really our civic duty, in my opinion, to wear a mask when we're out in public.
Thank you, Dr. Colli. So wearing a mask is a selfless act. It's how I protect my loved ones, my neighbors, and the person I come into contact with.
Absolutely.
Our next question is important to understand as Franklin County prepares to move into the green phase this Friday, June 19th. The question is, what exactly does it mean to be in the green phase, and how are businesses and services operating? John, could you help explain the green phase to us?
Certainly. The green phase was put together in a way to allow the economy to strategically reopen while continuing to prioritize public health and mitigate spread of the disease. When it comes to businesses, those that can continue telework are strongly encouraged to do so. Businesses with in-person operations must follow updated business and building safety requirements outlined by the PA Department of Health. This includes the requirement that masks be worn by employees and customers. All businesses that are permitted to reopen for the green phase must do so at 50% occupancy. This includes restaurants and bars opening to on-site food service, as well as entertainment such as theaters and shopping malls. Personal care services such as hair salons and barbers may operate by appointment only. And health and wellness facilities such as gyms are strongly encouraged to operate by appointment. Businesses that have already been operating at 50% occupancy in the yellow phase may increase to 75% occupancy. This is all to ensure social distancing can occur within the businesses and that employees can follow through with cleaning guidelines from the CDC and Department of Health. When it comes to social gatherings, mask wearing is still strongly recommended. Gatherings may include up to 250 people, but it's recommended to keep gatherings as small as possible. What's really important to remember about the green phase is that it's helping facilitate a return to semi-normalcy while putting safeguards in place to prevent mass spread and the need to completely shut down again. I know we're all anxious to get back to normal. This has been a difficult time, but we must remind ourselves that we're in this together. If we show kindness and compassion to one another through these adjustments and any issues that might arise, I think we'll come out of it stronger as a community. Our economy will recover and we will find solutions that address the pandemic, but that's going to take time. Until then, let us all do our best to follow the guidelines for the green phase to help protect our family and our neighbors.
Thank you, John. That is a compelling statement about the importance of following green phase guidelines. Thank you for expanding on that. Before we wrap up, is there any final message either of you would like to leave with our viewers regarding the health and safety of our community?
Yeah, thank you. I would. I'd like to talk a little bit about where we've been with COVID-19 and where we still have to go. You know, to be frank, Franklin County has seen the devastating effects of COVID-19 firsthand. We've had over 850 of our citizens become infected. We've had over 40 of our citizens die from this. And make no mistake about it, at one point here in Franklin County, we were ground zero for COVID-19 in South Central Pennsylvania. We far outpaced our neighboring counties when it comes to overall infections, hospitalizations, ICU admissions, and deaths. However, we've come a long way. Through adherence to physical distancing, vigorous hand hygiene, and universal masking, our case counts have been falling rapidly. We are now prepared to enter the green phase of Governor Wolf's staged reopenings of our state, where some of the guidelines that got us to this point will be relaxed. As we enjoy some of the simple pleasures that have been taken away from us by this pandemic, like dining in a restaurant and shopping in a store, let's not forget that some very simple measures can hopefully help us to continue to not just flatten, but obliterate this curve. If we all continue to mask in public, avoid large, unnecessary gatherings, and diligently wash or sanitize our hands, we can mitigate the spread of the virus in our county and keep us in the green phase.
Thank you.
I would just echo the words of Dr. Colli. I mean, we're headed in the right direction. We can continue to head that way if we follow the processes that Dr. Colli outlined and continue to see the risk of this threat of the COVID virus go down.
Thank you, Dr. Colli and Mr. Thierwechter, for joining me today. That concludes our first video for Franklin Forward FAQ. This series is brought to you by Franklin Forward, a group of local stakeholders committed to turning the COVID-19 pandemic into an opportunity to reimagine Franklin County. To learn more, visit franklinforward.org. If you have any questions about how to safely navigate the ongoing crisis that you would like answered in future episodes, please use the survey link provided with this video. We will see you again next week. Until then, remember, safety doesn't happen to you. You have to do your part. Thank you.